Welcome to another episode of Dr. Dallas Unleashed. And we actually have a surprise guest on today.
Yes, we do.
Anjelica, do you know who that would be?
I'm thinking I do know who it is.
We have, drum roll, Dr. Miami. Hey, man, Michael, Dr. Miami, please say hello so everybody can hear your voice. And
hello.
There's the famous Dr. Miami coming right out of Miami today, and so we're really happy to have you here. You know, Dr. Miami is famous worldwide. You know, he's really the one I think that kind of introduced plastic surgery to social media, or one of the starting pioneers of that, and very thankful for him doing that, because a lot of us who ended up getting into it, we can thank him for kind of showing us the way,
the path,
leading the path. And he's on Snapchat, he's on Instagram, he's on YouTube, he's got his own podcast. Is that right?
Don't forget TikTok.
Oh, TikTok, yes.
We played with that a little bit. It's
did.
so fun.
It is fun.
We've seen some of your all stuff. It's really great. It's fun, right? TikTok?
It's super fun. You get lost down that rabbit hole for hours.
I know. I feel like I watch it and I start watching all these college cheerleader girls start doing all these like songs, and they're flipping around, cheerleading stuff.
The algorithm must know you well.
Yeah.
Right.
Yes. So it keeps showing those to me. But no, it's been really great to kind of see Dr. Miami, kind of talk to him behind the scenes. But, we have a lot of questions for you, Dr. Miami, and I just want to get right into it. I've seen this penis surgery that you started doing.
You really are going right for it.
Yeah.
We are going right for it.
I want to know what got you interested in doing penis enlargement surgery, and the kind of the controversy that surrounded it when you showed your first surgery on, I believe, Snapchat.
Wow. So I have a penis. So
that is true.
I'm aware of the anatomy. And secondly, the way I found it was there was an article in an online magazine called Mel, which is it's like an online magazine for men that was started by the founder of the Dollar Shave Club. Okay. I guess he made like millions and millions of dollars and had something, as like a hobby. He started this magazine.
Right.
And they sent me like a questionnaire. What do I do before I go to sleep at night? I told them my whole nighttime routine, et cetera, et cetera. And they made like this funny little article, and they sent me a link to it. And I read it quickly. And then I noticed the very next article was about this penis implant. I'm like, wait, what? That's a thing? And so I clicked on it, and it opened up, and it's all about Dr. Ellis, and now it goes through this whole story of like, I think they called him like Big Randy or somebody. Big Randy apparently is like a nudist.
Okay.
And in the nudist colony, they call him Big Randy.
Right, of course.
But he wants to be bigger Randy. So he goes through the thing, and he gets to be enormous. And he tells the whole story about going home on the plane from L.A. wearing gray sweatpants. All the stewardesses are giving him extra attention and everything. Oh. I thought, wow. I'm like, this is for real? And then I started Googling about it. And so I read the article, and I told Rosie, Rosie, we got to get a hold of this guy and see if this is legit. And he was real nice, Dr. Ellis. And he said, yeah, 100% this is legit. I've done 4,000 of them. We just published a paper. Oh. We just got FDA clearance for the device. I'm like, are any plastic surgeons doing this? He's like, no plastic surgeons, just urologists. He had trained maybe like 2 or 3 urologists. He was this like lone wolf out in L.A. Working on it since 2002.
Oh my gosh!
Awesome.
He's been in practice for a long time doing this. Yeah,
yeah. He's like he's been in practice like 40 years. I mean, he's like I was in late 60s or so. He's like and he's a urologist in L.A. and he was the head of urology at Beverly Hills Hospital or whatever, Cedar Sinai or whatever, and he's been doing this kind of like on the down low for years and perfecting this implant.
Yeah,
and so I said, can I come and see you do it? He said, sure. And I went out, I watched him do it. And so I said, look, can I put it on the Snapchat if I watch you do it? He said, sure. We put it on the Snapchat, and it just like blew people's minds.
Gosh.
Amber, our office manager, it blew her mind too. And she talked to her husband.
I didn't know you could turn a penis inside out.
Yeah.
I remember reading the article in Mel, and they described inverting the penis inside out. And I thought the reporter probably just doesn't know what he's saying. Like he just used the wrong word. But no, that's what they do.
Isn't that weird? I mean, we're plastic surgeons, and I've never seen that. And until I saw, it's crazy. It's not like we get trained to do penis surgery.
We do. But we do. I mean, I do circumcisions all the time.
Sure. Yeah.
Right.
So I know the penis, but I didn't know you could flip it inside out.
Anjelica knows penis.
Oh, I mean,
I'm just joking,
but did she know
Anjelica.
You could flip it inside out.
Right,
I did not know that you could do that.
You don't want to do that on a awake person.
No, I
Anjelica.
don't. I do not.
But let me tell you, that whole inverting the penis thing, that's a game changer, because until now, you have to make incisions on the, I always thought making incisions on the skin of the penis when you do injections.
Exactly.
So there's always the pot that you don't want a penis that's scarred.
Yeah. Yeah. Exactly.
And you don't want the implant exposed. Like if the wound breaks down or something.
Exactly.
But
because then you're going to get a penis that's scarred down. And it might turn left or right, just like someone's golf swing, right? Short and crooked.
Well, you know what?
And you don't want that.
One of the reasons he started doing the implant to begin with was for Peyronie's disease, because a lot of patients were turning one way, and so the implant was designed initially to stretch it forward, and it works like a charm. Anyway, so I went down, I watched the penis surgeries, I Snapchatted it, and he said, "Look, if I can train you. You can be the first plastic surgeon to do it." Because right now there's only like a couple of urologists doing it. Right. I said that'd be fantastic, and it just so happened, literally the next week we had a hurricane in Miami, or was heading for Miami. What was it called? Right. Dorian was heading for Miami, and I told my wife, "Hey, can we go to Beverly Hills to get away from this hurricane?" And she's like, "You want to see that penis surgery again, don't you?" I said, "No. I mean, if we're getting out of town anyway." So we went there, and I watched him again, and I spent a few days with him. Right. And then we set up October 24th. He flew here. I found a patient, a great candidate. Right. We did, I did it, and now I'm just waiting to see how the results, the long-term results, kind of pan out, and before I open the floodgates. Sure. Before it's like, we have a carousel of penises over here. I want to make sure.
Dr. Miami, it just got me to thinking now, who's a good candidate for a penis? What do you call it? It's not penis surgery. It's a penis enlargement, elongation.
It's really how it should be marketed and sold is as a cure for shrinkage. That's really what it is.
So in the flaccid state, you're going to be
longer. In the flaccid state, you will always be you will never have shrinkage, like full on shrinkage. Okay. Which is a big problem. Sure. Seinfeld talked about it. Yep. It's a thing. I saw that.
It's a real thing.
It's a real thing.
Anjelica, don't laugh. It's real.
That maintains your length at all times. But it also obviously adds significant girth. Sure. Like inches of girth. Right. Whether flaccid or erect, because the implant itself takes up space. Now, over time, the weight of the implant also gets you gains in erect length, but that can vary on the person. Right. But we know it does because if you measure where the initial incision is in the suprapubic area, you come back 2 years later, according to Dr. Ellis, and that incision is lower. Yeah. And I've seen some patients post-op years out, through FaceTime and whatever and online, and it works. So. Right. I think it's just the beginning. I feel like it's an area of plastic surgery that's been neglected. Sure. And I think it's the potential. The market is huge, and I feel like it has the best chance of being like a long-term effective solution. Up until now, and the reason I never really did penis surgery is because the fat injections tend to be kind of lumpy and unpredictable. Yeah. And it doesn't do anything for flaccid length.
Anjelica's yes, I know.
I know
lumpiness and penises. Have you seen a lot of fat injected penises?
The hyaluronic acid injections, increased girth, but yeah, it doesn't last that long. It can also be lumpy. And
so if someone, let's say,
the last thing is you're cutting the suspensory ligament of the penis,
right,
which was like the standard way to lengthen the penis. It changes the angle of the dangle. So like when you get erect, it doesn't go up. It just kind of goes straight and down.
Okay.
And that's not like, it's not great, you know?
Right.
So this kind of solves a lot of those problems.
So
and the other thing about the implant is you can always upgrade it. Like if you don't like it, you take it out.
Right.
If you want it bigger, you can, once the skin is stretched, you can go back 6 months or a year later, put a bigger size in.
Yeah. Yeah, that makes sense.
The only thing is, the only like downside that I see right now is that you're kind of limited by the size of the head of the penis, right?
Yeah.
There's no way to augment the head of the penis. So if you or Anjelica come up with a way to augment the head of the penis, that would solve the problem, because we can increase the girth like almost to the size of a Coke can, you know, a can of Pepsi or something.
Wow.
But if the head is small, then it kind of looks like a penguin. This big fat body with a tiny little head.
It's going to look crazy.
The head of the penis too?
No, because the head of the penis, it's not designed the same way as the shaft. The head of the penis, it's like there's no like plane there. It's like just a super vascular, spongy thing. Plus the urethra is in the way. You know, it's not.
Yeah.
We had a thought. Me and the boys in the OR were talking about hooking up like a vac to just the head of the penis and just use vacuum suction.
Right. I think that would kind of give you a little temporary bigness, right? But that vacuum.
Not temporary. If you keep it on for like 6 weeks or 6 months, I mean, I'm sure it'll.
Yeah.
You know, just by expansion, I'm sure it'll work.
Sure.
I think the next step with penis lengthening is going to be some kind of continual internal stretch, you know, like the way they do it for for any kind of expander, you know.
Yeah, a place where you can inject fluid or air.
That needs to be designed and then brought to market, and that's a long process. But maybe your grandkids will have that.
So if you take it out, it's just going to be like floppy?
Yeah, what happens if you don't like it and you remove it? I would assume that things would shrink.
Back to your old penis.
Yeah.
I mean, you don't touch the corpus at all, like the cavernosum, it's all there. So you have exactly what you have. You would just have this like. Think of it like a breast implant. If you take out the breast implant, you'll have like a pocket of like a capsule. Right. But that's it. You know, the rest of the penis works the same. Yeah. I mean, maybe that skin will slide a little bit because you'll have like a capsule that's smooth. But
well, maybe once you get a few more under your belt, Dr. Miami, I think I might have to go down there. What do you think about bringing penis surgery to Dallas?
I think you should. I think it'd be a big hit here.
It's a great idea.
Well,
that's
once
two
I get
against one.
Once I get a few more in my pants,
right? Get a few more inches in his pants, then we'll go watch that and bring it down to the Dallas area because, you know, like you're saying, there's not a lot of people. It's just urologists. And I think a lot of urologists get training when they do prostatectomies and there's issues with having erections. They're doing stuff around the penis just to allow them to have an erection because they have no more nerves. Now,
when they do stuff like, you know, like up until now, the penis implant, when you say penis implant to a urologist, he means one of those balloon things.
Right, exactly.
Right.
Where they actually like core out, they actually just extract all the good, you know, corpus tissue and replace it with balloons.
Right, right. And don't you pump it up with a testicle that serves as a sort of like pump up? Yeah.
Yeah,
interesting.
It's like those sneakers that used to pump them up.
Yeah, I remember those sneakers. Anjelica, any questions, or you feel pretty good?
But
I'm pretty good.
I know your man doesn't need anything like that, so you're good to go.
Listen, everybody could use a little more.
Yeah.
It's like saying, yo, he's too rich. She doesn't need any more money.
You could always use a little bit more. I agree with that, but well, that's good. I'm interested. I want to see more with Dr. Miami and kind of see how that goes.
You know what I was going to say is the urologists, although they're skilled technical surgeons, their practices are generally not set up to deal with elective cosmetic patients.
Sure.
So that's kind of like why I think there's a huge opportunity for plastic surgeons. We know how to explain things, how to sell and perform elective surgeries. It's not something that urologists usually do. So
right.
I think it's a natural fit for plastic surgeons.
That's exactly right. I mean, because they're not talking to patients like we do when we talk about breast augmentation, tummy tucks. I mean, we can handle that cosmetic aspect where some of these guys, majority of their practice is probably insurance and dealing with those people.
Yeah.
So,
and prostate cancer and urinary issues, and even like their whole, like the way their practices are set up, the waiting room, the patient flow is not like, it's not like set up for cash paying.
Sure.
Aesthetic patients. That's what that was.
Well, before it's going to sound like a penis podcast before we're done, but I had some other things I wanted to ask you, Dr. Miami. I think a really great story that I know that you and I have talked about, and maybe Anjelica hasn't heard this before, but maybe you can kind of tell the audience, like, how did you get into Snapchat? Because I know a little bit it had to do with a family member introducing you to something. So maybe you can kind of tell us a little bit about that.
No. I had been, I was just meditating one day and thinking about how I can reach my inner genius. And I said, Snapchat, that's the thing that's going to catch on, and that's going to be it. That's the whole story.
So yeah, I mean, I think that.
Okay, I'll tell you the real story.
Okay.
All right. The real story is, I got into social media. I really shied away from social media. In fact, I had a very lame Instagram page, an even stupider Facebook page. I had a website that had before and after pictures, which I was very proud of.
Right.
We worked on that website since 2002. Just keep making it. And we had like hundreds of before and after pictures. I thought it was like the biggest collection of before and after pictures anywhere in the world. I was so proud of that website.
Right.
And we had a lady come do laser hair removal for us. And she was like, 23, 24. And she said, Doc, you have to get on Instagram. And I'm like, what does she know?
Yeah.
She doesn't. What could she possibly know? I'm not going to listen to her. And then she had like 30,000 followers. I'm like, wow, that's a lot of, good for you. That's fantastic. But I mean, for years, I just didn't do anything
right.
with it. Then one day, a lady came in for a consultation, and she said, she was very rude, and she said, your Instagram is stupid.
Oh,
no.
That's intense.
That's
my Instagram only had like 200 followers or something. And I didn't post anything on it, but like, like nothing, basically.
Right.
And she said, why don't you post your before and after pictures on there? That's all I care about. And I said, why don't you go to my website? It has hundreds of them.
Right.
She's like, I don't go to websites.
And what year was this?
This is 2014.
2014.
That's like the start, I feel like, of social media
the start
age.
of kind of really Instagram people.
She said, yeah, actually, you know what? I actually have a vague recollection of when Instagram first came out, 2010 or 11 or something. There was a high school kid that had like volunteered here and went off to college. He came, his mom had been a patient, and he came back and he said, Doc, you should get on Instagram. Everybody's on Instagram, all the colleges. And again, I was like, okay, college kid, whatever. So, I mean, I could have potentially been on that way earlier, but it took like 3 or 4 stupid, stubborn people to make me actually do it. So anyway, the point is that the lady who told me my Instagram was stupid did not book surgery, and I never saw her again. Right. But I went home that weekend, and I thought about what she said. And so I took my before and after pictures from my website, and I put them on Instagram. And lo and behold, almost like magic, the Instagram account went from nothing to 1,000. And I remember we had a weekly meeting, and I would say, guys, I think if we play our cards right, we could have 10,000 followers.
Wow!
By the end of 2014 or something. And they're like, yeah, we can do it. And,
oh my gosh!
And I just kept posting every day, like very consistently, like an inspirational speech, a funny thing, and a before and after picture. And it grew to almost 90,000 followers.
Oh.
And I was so excited. And the girls in the office were just all excited to come to work and be on the Instagram and just whatever, just comment, like, and post. And then I woke up one morning and the Instagram was deleted.
Wow.
Yeah, I had made a joke about the Kardashians. It was Valentine's Day. And I made a joke about the Kardashians. And then it got deleted the next day, and I thought, gosh, those Kardashians are powerful. Like, how could they delete my account? But then I realized it wasn't that. It was that we actually had like a nipple slip on one of the pictures because we put emojis on the before and after picture. So that account was deleted. I was depressed. The office was depressed. I went home. My daughter, who was 15 at the time, said, what's going on? Why are you so depressed? I said, my Instagram account was deleted. She said, Dad, why don't you try Snapchat? At that point in 2014 or whatever, 15, Snapchat was very, very, very new.
Right.
Only thing I knew about it was an article I'd read in the Wall Street Journal about it being used for sexting.
Exactly. That's what I thought it was.
No, not always.
Did you use it for sexting?
I didn't. I did not.
Okay.
No.
But in 2014, 15, that's basically what it's known as.
Right.
A sexting app. So when my daughter was 15, told me that I should use Snapchat, I was a little bit concerned. But then she said they have a story feature. So, and that story feature had just started.
Right.
This story thing. And it was the first app to have that, to have like a story thing.
Sure.
So I went to the office. I told the girls about it. It happened to be that first day. I couldn't use the app, by the way. It was absolutely indecipherable.
Right.
It was complete. It was like a puzzle.
Oh my gosh.
It was all swipes this and swipe that. I could not figure out for the life of me. I could barely sign up.
Yeah.
But that first day there was a girl having surgery, and she was like 19 or 20, and she knew what Snapchat was. And so I just, added a line to our consent form for Instagram social media to Snapchat. And she signed up, and she said, sure, I'd love you Snapchat. We Snapchatted it. I went home. We had 1,800 viewers.
Wow.
And I was not impressed with that number because we had gone from 90,000 on Instagram to 1,800. It still felt like a failure.
Right.
But then upon further reflection and discussion, we realized that it's a lot harder to get 1,800 people to watch your Snapchat because there's no search. The only way people will watch it is if they told their friends.
Right.
It's like all word of mouth. It's like a truly viral thing. You can't pay for an ad. You can't boost it. You can't search it. So I felt it was worth doing again the next day. We did. And it 2,000, then 3,000, 4,000. And then by like the end of the month, it was 100,000, and then 200, 1 million. It was like insane. Right. And then the Instagram account we kind of ignored actually for a while. And it just kind of grew on its own that year, right?
Ignore it.
I mean, I ignored it. Maybe Rosie didn't ignore it, but I got excited about Snapchat that it's all
It was secondary.
It was definitely secondary. So I just focused on the Snapchat, and then the from the Snapchat, newspapers and TV programs called, and Nightline, and all the other jazz.
Hullabaloo.
All the hullabaloo. It was great, and then
and it's a little bit of a.
I knew I was onto something when I stopped at a traffic light about 6 months into it, and I was picking my nose, and a girl in the car next to me was pointing at me and excitedly pointing at me and rolling down her window and saying, "It's Dr. Miami, it's Dr. Miami."
Oh my gosh.
So I took my finger out of my nose, and I realized and all she wanted was just to say hi.
Right.
For gold over there.
When strangers start to recognize you, then it was more than just a marketing thing.
Sure. Yeah. I think just to see it grow like that, it's a little bit of an adrenaline rush to see that you're doing something that so many people find so fascinating. And I think it just goes back to, I tell a lot of people that beforehand, and Dr. Miami and I have discussed this, it was very taboo to have plastic surgery. It wasn't something that you told your friends about, and it was hush hush. But this is almost lifting sort of the curtain behind the scenes. And there was such an appetite for people wanting to see what we were doing, that we're not trying to hide something. People were proud of having surgery, and I think it was really great because in the end, we're educating people. I mean, and I'm sure Dr. Miami gets this too, but I have so many people that come in and say, I understand what the surgery was. I didn't really understand. That's what made me so scared of having surgery. So we were demystifying some of the scariness of surgery that, hey, listen, normal, healthy people can come in and do just fine, because you know how it is.
Right.
People just hear other things from other people. They hear the scary stories and oh my goodness, did you hear about this person? They had a bad result. But you can see good, healthy, consistent results by looking at Dr. Miami's, my Snapchat, and it's just really, really great. And I think it's been such a change for people. And I think a lot of the establishment, it took a while for them to come around, but now everybody's doing it, right?
Yeah.
Everybody's, and like you said, it demystifies, it educates, and it's completely changed. I feel social media has completely changed the way people in America and around the world talk about plastic surgery.
Sure.
It's like night and day, like from 2007, 2008, when my book my children's book came out, it was like all controversial that mommies are having plastic surgery, and how can you do that to your, now it's like complete reversal. And it's something people talk about openly and honestly, and and it's really a great time to be a plastic surgeon in that regard, Absolutely.
And that kind of brings me to the question. You talked about your book. I think it was 2008, 2009 when you published I think it was called My Beautiful Mommy. Is that correct?
My Beautiful Mommy. And,
it received, like you were saying, some criticism about, moms having surgery and cosmetic surgery. But I just wonder, and what's your thoughts about if that were to be published now, what sort of reaction do you think you would have gotten from a book like that?
I don't think it would have raised a blip on the radar.
Right.
At the time, it was like, at the time, plastic surgery, like you said, was very hush hush. Nobody wanted to talk about it or admit it. Admit it to anybody, let alone your own kids.
Right.
But when I wrote it, it was mainly as just something to give to my own patients, and just to because I saw a lot of kids coming, a lot of moms coming in with their kids and just lying straight to their kid's face.
Right.
And the kids were just terrified when their moms came home with bandages and looked funny and different or whatever. So this was kind of a way to ease them into the conversation.
Right.
But obviously when it came out, people thought it was like a children's book, like Goodnight Moon. Just read your kid before he gets bed. Yeah. And I'm like, no, it's a very, very specific target audience.
Yeah, it's like good night, moon. Good night, socks. Good night, droopy breasts. Yeah,
good night,
here come the perky ones. Yeah. I mean, it's weird because we're now so desensitized with the things that we see on Snapchat. I totally agree. Something like this wouldn't even create a lot of ripples,
it wouldn't.
And
the best part of that book. The best thing that came out of that book was the mocking of it on Colbert, on the Colbert Report.
Oh, really?
that was so funny, man. That guy's funny.
Right.
Anyway.
Yeah. No, I think that's, but it also shows kind of, I think Dr. Miami's sort of.
My even prettier mommy. So anyway.
But
my dad left me for my even prettier mommy.
Oh, yeah.
The mommy that went, my mommy left me for the mommy in that book.
That'd be a whole series of books, right?
It's a whole series.
Yeah.
But anyway.
But
but you're right. The culture has changed. Society's attitudes towards plastic surgery has changed dramatically, and it has to do with, like you said, educating them. People being able to see behind the curtain and take away the mystery of it.
Right.
Also, prices have come down too.
Absolutely. I think it was
the
only
recession.
Yeah.
The recession of 2008 had something to do with it.
Sure.
And again, just the popularity of it, and the fact that celebrities were admitting to it. It just changed the whole landscape.
Yeah. I think making plastic surgery, cosmetic surgery affordable to the masses, and I think that's what you've kind of introduced too. And also, our older population many years ago definitely didn't want to let anybody know. But now these people, and I'm sure you get this, they wonder why didn't you post my before and after picture? Why wasn't I on Snapchat? And I'm just like, well,
I get that a lot.
It's strange. But in a sense, it just really shows you just kind of, the generation that's a little bit younger is so much more open to that, which is so much better because, like yourself, Anjelica had surgery, and there are people just like her who want those types of surgery, breast augmentation. Is see someone like yourself, young, healthy, but has a great surgery, it means a lot to that next person who's watching it and is ready to come in and say, hey, I saw Anjelica do it. I can do it. She looks great. And it's totally different. Yeah,
I mean, everybody, wants to know a friend that went through the surgery first before you do it to yourself.
Right.
And with social media, you can have these quote, social media friends. You could watch them go through it.
Right.
And ask them questions and really, get the lowdown. So.
Right.
It's very educating for people. I think it's easier for them to see it and then know that they can relate in that way and exactly what to expect.
And they, I have a lot of people who come in who have never seen my website. And have only seen me through Instagram. And it's such a weird thing because beforehand, people would look at the website. Oh, I've seen that you've done this and your training was here. Now it's not so much about like, oh, you trained here and you did this. It's
because it's all about the before and after pictures and the stories of real people.
Right.
I remember that my one of my attendings when I was a resident, he said, "Son, they don't call it plastic book learning; they call it plastic surgery."
Right.
Which drove home the point that you can have a degree on the wall in the best place, and but that in the end of the day, patients care about what how you act, the results,
right,
and how you treat them, and all those things, and all those things can be communicated much more effectively on social media than they can on a CV.
Absolutely. And, it's a little bit where Dr. Miami and myself can present a little bit about, our bedside manner, how we explain things. I'm sure you get a lot of people who come in and I do my best to tell them, hey, a tummy tuck is where the scar is. I'm going to tighten up the muscles. And they go, no, I got it. I've already heard all that.
Yeah.
Do you have any openings here? And I go, wait. I have to tell you a little bit about the pros and cons and why you're good. They're ready because they feel like they know you and they like
and
you.
They've heard you.
They've heard me.
Explained it 30 times.
Yeah.
Right.
And I've had patients come in, they're like, you know what? I'd do the operation myself if I could. I've seen you do the breast lift 35,000 times.
Right.
You're going to use the cookie cutter, use the number 15 blade.
Exactly.
3.0 PDS.
Right.
Oh my God.
Yeah. And they see me, I tighten up.
They're just like, I don't know what you call that fire stick thing, but if you give me the name, I'll get one and I'll do it.
Yeah, I'll take your welder machine and I'll do the same thing to the muscles. I'm like, well, it's not quite like that, but you got the gist.
They got the gist. Yeah, it's 1,000 times. It's 1,000 times more effective than a standard informed consent form where it's just a bunch of big medical words they don't know what it means.
And if you think about it, us doing this on camera every day is kind of like a consent. Although we don't have a signature, they're getting to understand because I'll talk about like, hey, I'm going to remove the skin and this is why I do this to minimize dog ears. But, if you do get a dog ear, we can fix it.
Right.
They're hearing about all these things. And then when I show people's post-ops, I'm like, if I could have done this a little bit differently, I would have done this. So I'm really talking them through like, I would have done this maybe a little bit differently, or I'm really super happy with this. They actually see an honest surgeon talking about great results, okay results.
It's not magic, It's not like you wave a magic wand and boom.
Right. Yeah. So, but the other thing I wanted to ask while we have you, obviously WAGS, which is the World Association of Gluteal Surgeons, you obviously have founded it. Maybe you could tell a little bit of people why you founded it, what's sort of the mission statement behind it, and the purpose behind it in general.
Sure. So the World Association of Gluteal Surgeons, we call it WAGS. The mission is to educate surgeons and the general public as to the safest way to do the Brazilian butt lift or the gluteal fat transfer. Right. And we felt there was a big need for it because there's been a lot of bad information out there, both to patients and to surgeons. There's some deaths that have occurred here in Miami, not in my practice, but in other practices in Miami, and all around the world, in the Dominican Republic, Colombia, Turkey. It got so bad that the surgeons in England have, if not really banned it, but they've shadow banned BBLs in England.
Yeah, I've seen that.
And so it turns out that the Brazilian butt lift can be done safely with a certain type of technique and certain types of instruments, but the demand for the operation outstripped the supply of surgeons that were trained that way.
Right.
And the amount of information and confusing information that was put out there to the public, people were not able to discern what was the safe way and what wasn't the safe way. So WAG's mission is purely educational. It's a nonprofit group. We have 100 and how many? 158 surgeons in 34 countries.
Yeah, that's amazing.
A lot.
Including me?
Including you, Dr.
Including me.
You.
Yeah.
Including you.
Yes.
And so basically the questions for patients that they need to know is that they need to ask is, and the facts they need to know is that the fat needs to be injected under the skin and on top of the muscle.
Right.
You cannot inject fat into the muscle or under muscle because underneath the muscle in the butt area, the gluteal muscles, there are these very delicate veins, and they are fairly big. They're like almost the size of my pinky in diameter sometimes. And if you tear those veins and inject fat in that area, the fat can be sucked into those veins, go into the central circulation, end up in the heart and lungs, and cause tragic consequences, including death.
Right.
So a lot of surgeons, when this operation was first developed in the early 2000s, were taught to inject into the muscle.
Right.
Turns out, not a great idea.
Right.
And the plastic surgery community just figured that out in the last 3 or 4 years. But getting the word out to every surgeon everywhere, and the reason it's international is because, you know, a bad outcome or a death anywhere in the world obviously is a tragedy. So we're trying to bridge all borders and all levels of training and experience. It's not just for board certified this or experience. We want every surgeon that's ever thought about or is going to do this operation to know the right way to do it.
Right.
At the same time, any patient that's considering this operation, we want to make sure they know to ask the right questions so they can keep themselves safe.
Right. And I think, you know, you touched on it just there. It doesn't matter, you know, there's a certain degree of, you know, who's doing the surgery, but if you're going to be doing the surgery, to understand how to perform it safely, right? It's not just under the purview of a plastic surgeon, but if whatever your training is, at least understand the concept.
Whatever it is.
Right. To do it safely.
Half the deaths in the largest study that looked at these operations and the deaths involved where half the deaths occurred in board certified experienced plastic surgeons.
So plastic surgeons are immune.
On the wall that keeps the patient safe. And it's not the degree on the wall that makes sure that the surgeon is going to do it the right way. The only way is to ask the questions and to make sure they're actually doing it, blunt tip, large bore, blunt tip cannulas and staying above the muscle. And so so hopefully the more surgeons we have that get involved, the farther and more wider the message can be spread.
Absolutely. I had a patient today. She wanted liposuction, you know, all the way around her tummy, but she was thinking about a BBL. But she goes, her worry was that in her research that a BBL procedure had the highest mortality rate of any cosmetic procedure. And I go, well, how did you, hear that? Was that something that you learned online? Apparently it was a friend. And I asked her, well, do you know why, people are perhaps, if they're not done correctly, they're dying. She didn't really understand why. She just knew the scary part about BBLs. You may die at a higher rate than having a tummy tuck. So I explained to her a little bit about what WAGS is trying to promote, and what we do here in Dallas in my practice is putting fat in the subcutaneous space, meaning above your gluteus muscle, is the safest place. Because right now, at least with our information available, just like Dr. Miami said, putting that fat in the muscle, you have a higher likelihood of damaging the veins, and that's where you get the fat that goes into the central circulation and can have disastrous complications. When I told her that, she seemed so surprised, like, oh, so that's why. She didn't know there was a distinction. So there's still a lot of misinformation and confusion amongst the public, and I think that's why it's important that WAGS is out there promoting, whoever's doing this to do it safely and not to just put fat wherever. The interesting thing is, I also heard from her that she had a friend who went to Colombia that they actually made. So Colombia has the same access to the information. It's not like they're on an island, but this particular surgeon, I'm not saying everybody in Colombia, made this patient sign a consent. I am going to inject fat into your muscle. You have a higher likelihood of dying if I do this, but you will not sue me if this happens. Sign consent. And I just said, wow, that's nothing you could get away with here in the United States. A consent like that would probably be thrown away in court. But in Colombia, you still have, and even here in the United States and across the world, that people still inject.
I don't know, Rosie, can you sign a contract for somebody to kill you? Is that legal?
Right.
You can't even sign a contract for somebody not to sue you.
Yeah. I don't know.
No matter what.
It's,
As long as consent space, you can.
yeah, so that's
Wow.
that's interesting that there was a consent. Like, hey, I know it's almost like the surgeon kind of understood that it was a higher likelihood, but he felt it was important to do it. So, anyways,
Yeah, I mean, it's like those people are playing with fire.
Right.
But I don't think the rate is 1 in 3,000, like
Right.
that paper said, 1 in 3,500. But it's not zero. You know what I mean?
Right.
And it's definitely, you inject into the muscle, you're playing with fire.
Yeah.
And if it's 1 in 5,000 or 6,000 or 7,000, I don't see where that makes sense to do.
Yeah.
How do you think people actually sign the consent?
Well, apparently this patient's friend did.
Oh, wow. Okay.
This is all hearsay.
People will listen. People do crazy things.
Yeah.
Yeah.
I mean, we all know that. I mean, people get those illegal butt injections in back alleys and hotel rooms,
Jeez.
and they die too.
Yeah.
So people do it. People do stuff.
Well, Dr. Miami, I have another question, kind of walking away from our WAGS discussion, and maybe a little bit more lighthearted question. But, plastic surgery, cosmetic surgery, however you want to label it, what do you see in the future? Kind of what's the next big thing? I kind of feel like penis surgery might be the next big thing.
We're going back to the penis.
But,
I'm gonna bet.
Do you think that's the next best thing? The next
I think
big
that's
thing?
the next big thing.
Oh, wow.
No pun intended.
Yeah.
Oh.
And it's the penis is the future, and it's growing.
Yeah, it is.
Literally.
I like that. If you were to ask me that, I feel like, and I get this question all the time, I don't like my legs. Can you liposuction my legs? And I just find that particular surgery is so fraught with, issues with dimpling, but I do feel like people want to have legs that they see on the red carpet. And I don't know if we had the technology to kind of make someone who's got maybe a thicker leg to make them look like a thinner leg, or a thin leg to look thicker. I don't know. I feel like we're lacking in the leg sort of area. What do you think? Yeah.
Rosie is nodding her head and almost welling up tears in her eyes.
Yeah.
So
I feel like we're lacking on, because just liposuction by itself is not, I think, the answer. But, I think it's going to be involved with a little bit of technology, with some liposuctioning. And who knows,
Aren't there like extra muscles we could take out there?
Exactly. I was thinking someone with a really big thigh. Do you go and remove
we can take flaps and things? Why can't we just go in there and pull out some muscles that you don't need?
Right. So, I get women who want me to liposuction their calves and ankles, and, there's a certain degree it can help, but gosh.
Calves and ankles they're fraught with danger, but you know what I find? After you lipo them, you have to tell them you need to wrap their legs for 6 months.
Wow. 6
From
months.
the feet all the way up. If I do anything below the knee,
Yeah.
I make them wear compression stuff and wrap from their feet all the way up to their thigh for 6 months.
Yeah.
Wow.
I have not had success with that, so I tend to move away and tell someone, listen, at least in my hands, I don't feel like it can give you a good result. But I think to me, that's the next. Maybe it's penis surgery,
Penis first,
and then penis first, and then the legs might be the next frontier,
right?
Perhaps, I don't know. That's
Maybe
just
like
me.
Toes. Or
You got me thinking.
Toes.
I'm going to think about that.
Right. So you've been in practice for a while, many years now, and I me personally, I'd like to see what you think, where you would be in maybe the next 5-10 years. Where do you see yourself? Good question, right?
Retired.
Yeah.
Retired.
Yeah.
I'd like my next job. I'd like to be a philanthropist. That's my next ultimate goal.
So
I would say, I don't know, in 10 years, it's so hard to predict. I mean, man, I would like to be doing nothing but penises and labiaplasties.
Oh my gosh.
As far as the eye can see.
I think I hear you on that because, and I tell Anjelica that all the time. I think about, my lifespan is doing the things that I'm doing now, which is liposuction and BBLs and breast. But, I don't think people understand that it's very physical. And your neck hurts, your back hurts, and because you're doing something very physical. At some point, it's not very mental, but it's just kind of mental, or I guess what do you call muscle memory, and you're just doing it over and over again.
It's very demanding. The surgeries are long. They're demanding physically, mentally, emotionally. There's a lot. I mean, I love it, but can you do it forever? You know what I mean? Can you do it until you're 70?
Yeah.
Right.
I don't know. I don't think so.
And that's
wear and
where,
tear.
like doing, let's say, a penis surgery. A labioplasty, they're a little bit less stressful on your neck.
They're way less
your
stressful.
back.
They're shorter
especially
in
than
duration.
Yeah.
The follow-up care, all the other aspects that go into the surgery are, plastic surgery is a young man's game.
Yep. Yeah, I agree. And that's why you don't.
As I get older and sail off into the sunset,
Yeah, I totally agree. I think about that, all the time that, I can't keep up a certain pace where you're liposuctioning and sweating and, your back hurts after a long week. You see me, I kind of crawl out of the OR on a Friday and I'm sure Dr. Miami kind of feels the same. He probably is a little better shape than I am.
Intense.
It's tiring. And then, he said something that I think a lot of people don't really understand the implications of it, but there's an emotional investment in all your patients, and
everyone,
just like, you want the best for your patients, and there's nothing.
They're not patients. They're like adopting kids.
Yes. Yeah. And when I have a patient, I tell the girls and Amber, I don't do this necessarily because it costs this much and I can make this much money. I honestly could live with just being able to pay, certain bills, but my currency is someone saying, you changed my life. I feel so much better about myself. And I could live off a compliment for like 3 months and then not sleep for 5.
I mean, your wife will leave you, but you could live off.
Right. But, when someone says they're not happy, that ruins me for, like the next couple days.
Never. No, it's like, I know we're very, look, plastic surgeons in general, where we tend to be more on the perfectionist side, and also we're very, nobody becomes a surgeon if they don't enjoy hearing praise. It's like, that's our love language. So when the lack of praise is like, it's like taking away our oxygen.
Sure.
And a criticism is like sucking the oxygen out of your soul.
Right.
So. So that's a big part of it, and you're right. Like the smaller the operations are they're less emotionally taxing. Right.
So, we're definitely. I feel very similar in that, and hopefully most surgeons will think similar. They're not just doing it for the coin, for the scratch, for the car, for the house, but that really.
Well, I think most surgeons are just like us. Exactly.
Just doing it for the patient.
There's a few outliers. With bad reputations, they give the one bad apple spoils the whole batch, but mostly we're all like this.
Sure, exactly. I wanted to ask, with all this social media, what do you see as maybe a downside, sort of a negative to this growth of social media and everything's out there online? Any downsides to that? Maybe not.
Not really. I mean, other than the fact that people can waste hours and hours and hours of time, I mean, it's a kind of a time waster for a lot of people.
Sure.
Right. I mean, if it doesn't have to do with your business or your livelihood or your education, then the rest of it is just pure entertainment, and it's slightly addicting, and so you can definitely waste time. Yeah. But I mean, look, I feel like there's other ways to waste time too. So.
Sure.
It's just competing for that.
Right. I mean, I guess you could be, shooting up crack or heroin, smoking those marijuana reefers.
You could be smoking marijuana.
Right.
Yeah. I mean, if you have a reefer or, magic mushrooms or whatever. Or you could, look, I remember in the 80s before the internet, people were playing with Rubik's Cubes for hours and hours and hours. I'm not necessarily sure that was that much more productive.
Right. So what's a little bit of Fortnite and looking at Dr. Miami's Snapchat? That's a good Saturday night for a lot of people. So
I don't think the internet has ruined the world or anything, or social media. Yeah. But it definitely gives you more options, for wasting time.
So I did want to ask one thing. Okay, Dr. Miami, what's the strangest or craziest thing a patient has ever asked you?
So the craziest, strangest thing was a lady came in with a friend. She wanted a labiaplasty, and she had her friend pull down her pants, and she said, "I want my vagina to look like her vagina."
Oh my gosh!
Only she didn't say the word vagina.
Okay.
Oh, okay.
She used the let's say the
kitty word.
The kitty word.
The kitty word. Yeah. And that was weird. Because
weird.
most people come with pictures.
Yeah.
They don't come with an actual
model.
Right.
You know what I mean?
That is that's different.
Well, the next version of that is like, I'm coming with my friend. I want my penis to look like his.
Right.
Yeah.
Well, that is probably going to happen. Actually,
That's the next.
now that I think about it.
Yeah.
I won't be surprised when it does.
You'll be getting a lot of different photos too. Also, last thing is, how do you balance your work life and family? I feel like you're pretty busy.
Well, I've started taking Fridays off the last 2 years. Yeah,
that's nice.
That's been a game changer for me.
Yeah.
Huge difference.
Right.
Just taking Fridays off.
Because you have how many children?
5.
Wow.
So that's not 1 or 2 or 3. 5 is a whole different level.
Yeah.
And I don't know how you guys manage that, but I can only imagine having Friday off, and then you have what, Saturday, Sunday typically off?
Saturday, Sunday. I'm an Orthodox Jew, so I take the Sabbath.
Right.
So like we don't have any electronics or anything from Friday night till Saturday night.
Yeah.
So that forces the family to kind of get to know each other and sit together and socialize and just eat and hang out. So that's a big, for me, that's a huge thing.
Right.
Because if we didn't have the Sabbath, I think that I probably wouldn't know my teenagers like at all, because they would just continuously be on Fortnite and their electronics and whatever. So,
and I think that's really important because we share stuff on Snapchat, and I show a lot of stuff with my wife, Dr. Rejuvenation, and my 2 children, and we get a lot of people who actually come to us because they say, I'm a lot like you. I work during the day, but I also got a family. I got to run around with the kids and drive them to soccer, and they can relate to that, and they actually feel more comfortable with me that I go through the same pressures of trying to be not only a good doctor, but I'm trying to be a good husband, a good father.
Yeah.
And, I'm not perfect, and I'm not there for every game or soccer game, but I'm doing my best. And I think just seeing, people seeing that, I'm doing the best that I can with what I have, they really relate to that. And I think that's the same with you, family is important, and you're probably getting a whole segment of people who go, you know what? He does see that as a priority. He just doesn't see me as another number, and really enjoy that about us. And it really, So
can I ask you a question?
Yeah.
Well, I know you work with your wife. How's that work?
Well, so Dr. Nguyen, Nguyen, she's Vietnamese.
Yeah.
That's where we get the last name. She's a urogynecologist, and so that means she trained in OBGYN, and she deals mostly with kind of pelvic reconstruction. Well, what does that mean? So women who have usually had children who have urinary incontinence, they leak urine when they laugh or cough. She's doing surgeries to kind of tighten up that pelvic area, but she's also doing labioplasties, cosmetic labioplasties, and cosmetic tightening of the vagina. And so we share the same office, and we see each other every single day. And
what's that like?
So what is it like? I
see my wife every single day, but I go to work. I don't see her for a little while.
I mean, people ask that. I think it's freaking great.
She's like a boss lady.
She is. She kind of runs the show here, but that's okay.
That's it. So see, that's the thing. Like in my home, I'm like vice president. I'm not even vice president. I'm like maybe Secretary of State or something.
Speaker of the House. Speaker of the House.
But I'm like fifth in line.
Right.
In succession. But at the office, I feel more like a boss.
Right.
Or to Rosie. Maybe I'm second in command here.
Right.
So you go to work and she's still the boss.
Yes.
Yeah.
Wow.
Yeah. No, he's the boss too, but
at least you don't ever have to make a decision. So that's good.
Right. I think there's
you just follow orders the whole time. That's good.
There are times where I try to, assert myself, but I know when to tuck my tail between my legs and just bow down and say,
happy wife is a happy life.
Yeah,
that's right.
So it's exactly that way. But it's a wonderful relationship because at the very end, we can see each other. We have lunch. We have that's cool. Unlike where, as someone who's not married to someone in the professional field, I can tell her, listen, I had a day in the OR, didn't really go the way I wanted to, kind of was tough. She can relate to having a difficult surgery, maybe a hard patient to manage. And so that's sort of
true.
Be able to communicate that sort of thing, and her empathizing.
So she's also like a therapist too.
Correct.
Yeah, you guys work very, very well together.
Yeah,
definitely.
So it's been a great relationship, and I couldn't ask for anything more. So far, so good. Dr. Miami, I'll let you know if anything changes or any advice. But so far, so good.
Just keep doing what she wants. I think it'll be fine.
Right.
Yeah. So,
if anything pops up, you can call into my podcast.
Yeah, exactly. We'd love to. So, I kind of want to wrap things up, but, I wanted to give a little praise to Dr. Miami, because we met how many years ago, Dr. Miami? Probably about 4 years.
Almost 4, I would think.
Yeah,
oh, wow.
Yeah. And so I would say that,
you're an OG. You're one of the OGs.
Yeah, the originals. But, I would say I've learned so much from Dr. Miami because, one of the things is, if you ever really listen to Dr. Miami and hear him talk, and I've heard him talk behind the scenes on camera, but, one of the things I really admire about you is that, you never say anything bad about another surgeon. And for some reason, as surgeons and plastic surgeons, whatever, we tend to want to, that person isn't so great, you should come to me. But I've never heard that from Dr. Miami. And I learned so much because I feel like we are trained to do that sometimes.
Right.
Like why I'm better than you. And it shouldn't be about why I'm better than you. It's like, what can I learn from you? Everybody has something special about what they do. And I can learn from that person who didn't train in plastic surgery, who might have trained in, let's say, OBGYN, but they're doing wonderful surgeries.
That's very true.
And it's really changed the way I thought about other specialties. And
very true. You can learn, what you said is right. You can learn something from every surgeon.
Right. And so I want to thank Dr. Miami for teaching me that, because unfortunately, even in our specialty as plastic surgeons, not only are we kind of trained to be like, okay, we're the only ones that are supposed to do this, there's a lot of infighting. Like, I'm better than you, and you're in the same, it's not about that. And, if you want someone who is really going to give you a consistently good surgery, someone who's not going to talk bad about other people, it's someone like Dr. Miami, who people like me, have really learned. And I don't do that. And even though I was sort of ingrained to do that, I don't do that anymore. And, I thank Dr. Miami for teaching me that. And I learned not only that, but a lot of other things, technical surgery stuff.
You're going to make me tear up and cry.
Yeah. But I think
because as you were talking, I remember watching other surgeons do that when I was training. And I remember thinking, I never want to do that. Like, I never want to sound like that guy. I never want to be, I once had an attending. He had what I called insulting Tourette syndrome.
Right.
I never want to. I don't want to be like that. You know what I mean?
Yeah. Well, I appreciate
I want to
you.
see the good in everybody.
Absolutely, and that's what it's all about. I mean, we can learn so much from each other, and even from someone who, and I think we tend to look at someone right out of practice, like, oh, okay, they're just young, but man, they might have learned something really cool and really interesting. And I still can learn from that person who's like 6 months out of residency, just as much as I can learn from someone who's been in practice for 30 years. So I thank you.
They may have just trained with somebody who has been practiced for 50 years, and they gave a little pearl that you never heard.
Exactly. So, again, I just want to say thank you for teaching me that, because I've changed a lot of how I do things based on you, and how I just treat people, and especially people who are doctors, and, I appreciate that. And hopefully people that see you and other doctors who learn from you also do that, because there's just too much, pointing fingers, why this person is good. And, we need to move away from that. And like you said, it's just about, surgeries that are safe. Ultimately we serve a higher purpose, which is the patient. It's not ourselves, it's the patient. So, anyways, sorry. Enough pontificating about this.
Thank you. You expressed it very well, and I hadn't thought of it like that, but you're 100%
Yeah.
right.
Well, these are little things I picked up along the way, and I'm glad I'm able to tell you. But, we're running short on time. Dr. Miami, thank you so much for joining us. And
thank you for having me.
Yeah,
it's really nice.
We're probably going to ask you, somewhere down the line. We'd definitely love to have you.
Yeah, have you
Maybe
back.
some other topics, get your thoughts on it.
Sure.
But thank you so much for joining us.
You're welcome.
Dr. Miami from Miami.
Woo!
Angelica, thank you for joining us. I'm
Thank
Dr.
you.
Dallas. Thank
Bye,
you for
guys.
joining us for another podcast. See you later, Dr. Miami.
Thank you.
All right.
Thanks.
Bye-bye.
Bye, guys.
Bye.
Bye-bye.
Bye.